Hi, hello, it's Nas Yubi. You're very welcome to my channel, and I must say that you're not going to ever regret stopping by to see my videos, because I always find a way of dropping good and informative videos for us about cancer and its related symptoms, and when to know that there is a problem for you to go to see a clinician or a physician to check up on you. So today I'm making my video to commemorate the Breast Cancer Awareness Month, as I'm going to tell us what breast cancer is, and I'm also going to show us how to detect a breast cancer, or how to detect when there is problem in the breast, so you know you have to go to see a physician or a doctor, or even talk to a nearby health professional, so that you'd be checked up on and then be treated on time. So don't panic. Like I used to say, cancer is not a death sentence. It's quite treatable, and if you detect it on time, it's very treatable. It's manageable, and you find out that you'll be treated, and then you're very fine and well to go about to do your normal business and work. So it's not just like when they say someone has a breast cancer, wow, you're going to go to die. Although it's very unfortunate, because in this part of the country we detect breast cancer quite late, and when it's late, man, it's very difficult to manage. Okay, but then still there is still hope for us. There is still hope, because we stand together and we always hope to give our patients the best. So today I'll be talking about breast cancer. So let me tell us what breast cancer is. Breast cancer is when the normal breast tissues grows out of normal and out of control. That is when they say the breast is cancerous. It grows out of control because the cells of the body has its lifespan. When it grows to a certain point, it's supposed to die. We call it the principle or the law of apoptosis. The cell will die while new ones grow. But in this case, the breast lump or the breast tissues grows out of normal, and it doesn't obey the law of apoptosis anymore. So that is when it is termed as cancer. That's it. And then the signs or the symptoms you notice, and you know that this is breast cancer, or this is a problem and needs to go to the hospital to sort yourself out, is number one, there is always a lump in the breast. There would always be a lump in the breast, a palpable lump in the breast. That's what we see as the number one symptom of breast cancer. Okay, so when you detect a lump, most of the time this lump is going to be hard, is going to be at one point, is meted and fixed. It doesn't move, it's not moved. So this is your breast and you see a lump. Normal, we have other lumps in the breast. We have benign lumps, we have very innocent lumps. Those ones are mobile, and if we touch it, it's going to feel in your hand as if it's running. Okay, so that's how to differentiate between a cancerous lump or a normal lump. But in any of the cases, you have to see a doctor so that you would be treated and checked up on time, okay, when it's not too late. The other things that you find out about breast cancer is when you notice a swelling. Maybe one of your breasts, these are your two breasts, and one of them becomes slightly larger, or even much. There is a very significant difference in your breast. One becomes a lot bigger than the other. Please, you have to see a doctor. And then you also notice a sign of pain. Okay, maybe in your nipple area or in the other part of your breast. You have 4 quadrants, or maybe if you're taking a bath, you notice that one of your breasts is painful. Sometimes we have pains in the breast when we are in our cycle, or in between our cycle, of when we're ovulating. This is normal, but when you find out that the pain is more intense and severe, that you can't even bear, know that there is a problem and you need to see a doctor. Notice these are the first 3 most significant symptoms of breast cancer that you notice that makes you know you need to go to see a doctor. So I'm going to come back in my next video to tell us other symptoms that are very and quite interesting for us to know about breast cancer and when to see the doctor. But meanwhile, you stay tuned, and thanks for watching. Bye.